Hey, this is Dr. Keith Hersey, and you are listening to the Destroying Diabetes podcast. Hello, everyone. This is Dr. Keith. Welcome everyone back to my Destroying Diabetes podcast. I'm just glad for all of the support that you've given me and all of the feedback that I've gotten. And I appreciate it. Keep the feedback coming. And if there's anything particular that you want us to address in a future episode, please contact me and we'll be sure to find a way to get it in. And like I said, we really appreciate your support and feedback. The most important thing, just let your friends and family know about the podcast. Anywhere that you have an internet connection, you can listen to a podcast anywhere in the world. Like I said, I'm still looking for the first person from overseas to say that they listen to the podcast. I still haven't gotten an email from overseas yet, but I'm sure there's somebody listening outside of the continental United States. So I'm looking forward to that first email from someone outside the continental U.S. So feel free to contact us. Let us know that you're listening. Like I said, spread the word. If you could subscribe to the podcast, if you could leave us a review, a 5-star review, that helps us as well. So again, just thankful for everyone that's supportive of the podcast, and just continue to listen and support and subscribe and spread the word about it, because the best feedback that I get is I have people spread word of mouth and they pass it along to a friend or family member, even if they didn't have diabetes, that they may pass it along just for someone to listen to get some information. And that's the main purpose of my podcast, is just to provide information, particularly about type 2 diabetes. And I guess they said they let me in again. They didn't lock the door, so I guess someone said it was okay for me to do another podcast. So I'd like to thank Dr. Thomas Hunter. He is our guest today, the podcast. He is graduated from the University of Tennessee Medical School in Memphis, and he did his residency in ophthalmology at Howard University. So go Bisons. And also he is at the Duke University Eye Center. He's an assistant professor of ophthalmology at Duke. And he also works at the the Durham VA hospital. On staff is there as well. And his specialty is dealing with cataracts and glaucoma. So I wanted to have him on the podcast today because I think is very important, is crucial, the relationship between type 2 diabetes and eye health. Unfortunately, I have several of my patients that didn't really do a great job of taking care of diabetes, and they had vision problems and have limited sight, or have maybe even lost partial vision in one or both of their eyes. So don't want that to happen to any of my listeners out here. So I'm glad to bring Dr. Hunter on. And did I get everything right? Is there anything else that you would like our audience to know about you?
Hello and good evening, and thanks for having me on. No, I think you got pretty much all the points.
All right. Well, like I said, I just glad that I know they have a busy schedule. I'm just glad that you were able to have a few minutes with us, and really appreciate that. One of the main things that I wanted to address is what is the relationship that I'm sure patients feel like they hear that all the time, especially if they have diabetes and it's progressed in the type 2 diabetes, and the doctor may say like and it's not being controlled, and one of the doctor's warnings is that if you don't get control of like your blood sugars, that you can affect like your organs. It can affect particularly like your eyesight or your vision. What is kind of like just in general the relationship between type 2 diabetes and um, eye care and eye health, and what are some of the main issues with that people need to pay attention to?
Yeah, so kind of like you mentioned, diabetes affects a lot of organs, and the eye is unfortunately no exception to that rule. The high blood sugars will damage the eyes in many different ways. First, it can damage the blood vessels of the eyes, which is the major reason why people lose significant amounts of vision in diabetes. Um, and there's different levels. We call that diabetic retinopathy. There's different levels to that. We have the non-proliferative diabetic retinopathy, which can cause bleeding and swelling in the eye. And then you have proliferative diabetic retinopathy, which can cause more advanced bleeding and swelling in the eye. But yeah, so yeah, diabetic retinopathy, non-proliferative and proliferative diabetic retinopathy, the major causes of vision loss. But diabetes can also uh, decrease the vision in other ways. Diabetes can cause advanced cataracts, as well as glaucoma inside the eye, which are other forms of vision loss. So pretty much, you know, the number one, two, and three causes of vision loss in the world, diabetes can be related to it. Um,
Okay, it, so what do you think that or recommend like someone that's like has like type 2 diabetes, who do you think that they should get their eyes checked, or should they, unless they're having or feel like they're having some problems before they get
no,
checked?
no. Everybody who has diabetes, type 1 or type 2, should be, my recommendation, getting their eyes checked every year. You know, the best way to prevent the vision loss and diabetic retinopathy or diabetic related eye diseases is early detection, right? There's a lot of times once the bad processes kind of start, it's very hard to control, right? Bleeding in the eye, um, is very hard to control. Glaucoma can be very hard to control. Right? Cataracts, a little bit more straightforward, but in a setting of advanced diabetic retinopathy, very hard to control. So you really want to catch all of these conditions, that's diabetic related, before they become a problem for you, right? Um, so yeah, again, I tell all my patients with diabetes, that it all, for me, it all starts with what they're eating, right? If you can control some of the foods we're eating, lose weight, diabetes in general will tend to be more controlled. And in return, you get to now reduce your risk of having the number one, two, and three cause of blindness in the world, right? So it's kind of a no-brainer, and for people who, I feel like my patients who don't have it, they are, you know, probably in general, they're usually less concerned. Once they start having signs of diabetes, I feel like that concern level kind of goes up. They start to feel like, okay, this is a real thing, right? You've been talking about it all these years. Now I'm starting to see that my vision is starting to decline, and no one wants to go blind, and so they start to take it more seriously. Now, it's the ones who haven't been getting their eyes checked, and when you see them, they've come in with more advanced and severe diseases, they really tend to have the most struggles. And that's when I'm usually sending them to my retina colleagues for treatments.
Yeah, so and then also when you said to see like the eye doctor, is there like um can I just go to my eye doctor and see somebody? Or, the places where they just sell glasses, lens crafters, those type of places? Or should
Yeah,
I see
any
somebody
mm,
that's like an ophthalmologist like yourself?
any eye care professional can definitely diagnose, diabetic retinopathy, glaucoma, the cataracts that come along with it. And typically, if you were to go to an optometrist, again, they specialize, in eye exams, the glasses, you're going to get great eye care, right? And if they see something that they feel needs more, management by an ophthalmologist, they typically will refer those patients out uh, to the specialist. So I would say the most important thing is to make sure that you're getting your eyes checked, whether it's with an optometrist or an ophthalmologist. Once disease is detected, then I usually recommend management and monitoring with an ophthalmologist.
One of the things that like said is that if someone comes in and they may have some issues, but it's not progressed to where it's vision loss.
Uh-huh.
If they're able to get their blood sugars like in A1C down and under control, is that any does that ever reverse itself, or it just stops the progression?
It just slows it down. The I've seen patients who've gotten under control with mild diabetic retinopathy, again, little spots of bleeding in the eye we call microaneurysms. I've seen those not progress if the blood sugars were controlled. I very rarely see them ever just go away completely, you know. But again, the microaneurysms, the little spots of bleeding that you see inside the eye uh, don't typically cause vision loss. Again, you may get cataracts and things like that with it that can cause vision loss, but those little spots won't cause it. It's usually when you start getting the swelling, the macular edema. The macula is the part of the eye that controls your central vision. And so if there's any swelling in the macula, it's going to immediately start to decrease your vision and you're going to start losing vision immediately. That's a little tougher to control, right? But it is controllable with modern treatments. But I would say, it's, I won't say it's impossible. I don't think anything's impossible, but the 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 diabetic retinopathy very rarely ever goes away. Um, we just want to prevent the aspects of it that causes the vision loss. The macular edema, the vitreous hemorrhages. The vitreous is the inside of the eye. You don't want bleeding there. We call that a vitreous hemorrhage. And so you don't. That's where you don't want the disease to progress to.
And what would you say? What would be like a symptom or a sign that someone say if someone they haven't really, they know they have type 2 diabetes, but they haven't really been seeing like a primary care provider, and they definitely haven't seen like a optometrist or ophthalmologist. What would be like a sign where someone would probably need to see somebody, right away that they may experience?
Well, the first thing is the vision. The vision is the vital sign of the eye, right? So, if they notice any changes in their vision, that's going to be the first indicator that you need to get examined. Some people with with diabetic retinopathy or diabetic eye diseases will start to have issues with night vision. They'll have issues with dryness of the eye, so burning, irritation of the eye, light sensitivity um, would be an indicator they're getting diabetic eye disease. Um, this is night vision, floaters. So floaters typically, when you start seeing floaters, it could be a sign that there's bleeding inside the eye. So if they're having a lot of floaters, so pretty much any symptoms that you're having, um, can be a sign of diabetic eye disease, right? Again, all the way down from dry eyes. When you mentioned that one, most of my diabetic patients do have dry eyes, irritation, light sensitivity, burning, itching of the eyes, and they're using artificial tears, not realizing that that is an indication that they may have diabetic eye disease. So yeah, pretty much, you know, anything that's unusual about your eyes should be an indication to see a professional.
Okay, yeah, that's definitely like if you experience any kind of change in your vision, yeah, you definitely, especially if you're type 2 diabetic, you need to see somebody as right away. So if someone has and they've been diagnosed, say with some type of diabetic eye disease, what's usually like the most common treatment that you have with your patients?
It depends on the severity. So we're talking about mild. So mild, non-proliferative diabetic retinopathy can have different forms, little spots of bleeding, or it can have macular edema. The macular edema is the part that actually starts to decrease the vision. So for that, there are different treatments. There are injections, that you can do into the eye. Most people find that relatively scary, but it's very safe to give an injection of different type of medications. There are steroids, anti-VEGF medications that can be injected into the eye to help control for macular edema. Um, then, as the disease progresses, into the proliferative diabetic retinopathy, that's where the eye starts to form. Once the old blood vessels get damaged, the eye tries to make new blood vessels, but those new blood vessels are fragile, and so they bleed a lot easier into the eye. That's when you start getting things like vitreous hemorrhages, retina detachments, and again, more and more swelling inside the eye. And so as you start progressing into the more advanced stages, there are laser treatments that can be used to keep it under control. And as a last resort, there are surgeries in the operating room that can be done to get it under control. Again, you definitely want to control your diabetes before you get to the more advanced stages of the disease. There's a high risk and high rate of vision loss and blindness the further along down the line that you get.
And there's another thing, and this is my favorite of the patients, and I like the opportunity for them to hear directly from the eye expert. Now, we have patients, and especially with glaucoma, and they have to use like medicated like eye drops to help treat the disease. So, what would you recommend the best way for people to administer eye drops without I know that people deal with excess like spilling of the drops, not reaching the eye and
Yeah.
wasting drops.
Yeah, it's, proper eye drop installation is, I think it's different for everyone. And so typically if I have a patient who's been having challenges getting the eye drops in, we try to figure out, during the evaluation, during the examination, what's going to work for them, right? Some people like to lay on a pillow and put a drop on the eye. Some people, pull their eyelid down, the lower eyelid down, and put the drop in the eye while holding their head back. Um, some people, if you have a spouse, will get their significant other to put the drop in for them. That's going to be the easier way, right? The easiest way. And so, you know, it's many, many different techniques, right? There's a lot of videos on YouTube that can show you how other people are doing it. And then I tell people, do that research, kind of figure out what's going to be best for you. And then lastly, there are eye drop helpers. So if you go on, a shopping site like Amazon, you can type in eye drop assist devices, and they have little devices that you put the bottle into the device, and you hold this device over the eye, and squeeze the bottle, and the drop can go directly in the eye, right?
Mhm.
The hesitancy that comes with putting drops in the eyes is that when you see that drop kind of coming towards you, people tend to react to it.
Yeah. Yeah.
So again, the thought behind the device is you really, don't really see the drop coming. And so then therefore you don't, resist the drop kind of getting into the eye.
Yeah.
And so again, people with smaller eyes tend to have a little bit, tighter eyelids, tend to have, the most struggles. But a lot of different techniques, those guides, those auto drop guides, really help a lot if you don't have somebody else that can do it for you. And so yeah, I would say those are the different ways.
Yeah. And definitely like if you have um if you don't have someone that can help it or like I said, if you just have trouble, just some people just they may have, shaky hands, especially people that are older. And I had one patient one time, and she would go through, you know, uh, she would go through like a 90-day supply in 40 days, and then and so I was like, what? And then she gets caught in the thing where like she ended up having to pay out of pocket because it was in between where the insurance would cover to get the refill or not. So I recommended to her that to use one of these devices, like that will make it like a lot easier to make sure that you're getting the drops in your eye, and then you don't have to, you can get your you can use the dosage as directed, and then you refill it, within the time the insurance, so you don't have to pay out of pocket for any eye drops. And it was like she just thanked me because it was just like for her, it was just a lifesaver, and then save the money because then she won't have to go out of her pocket to buy an extra bottle or whatever because she wasn't reaching her eyes and stuff. So definitely, I would say definitely if you're someone that has to use eye drops, that like I said, just find whatever works for you, and like I said, that's going to vary from person to person.
Yeah. And there's, I mean, and then, there's different levels of glaucoma. So mild, moderate, severe. And I guess depending on where you are in the, you know, in that staging, then we do offer different treatment options. And so we have laser treatments, which can sometimes get patients off drops. They work very well. Laser SLT, so trabeculoplasty. That works very well at getting patients off if they're on one medication. Sometimes that's the best option. We have different procedures we can add. A lot of our elderly patients have cataracts. And so we can do procedures during the cataract surgery that can also get you off the drops that work very well. And then for our more advanced glaucoma patients, there are surgeries that we can offer to kind of get you off drops as well, and they work well. And so again, the key to just management of things like glaucoma is not just drops, but the the thing that's going to keep you from losing your vision in that condition is just having that relationship with your doctor, your glaucoma specialist, right? And I do recommend my glaucoma patients to see a glaucoma specialist, to build that relationship, to figure out what's the best long-term thing for them is. If it is, an issue with shaky hands or arthritis and they can't get it in and we can't find a solution, we can come up with a plan that's best for you, right? It's not one size fit all, right? So yeah, that's just the relationship you should have with your eye doctor.
Yeah, that's definitely a plus. So you want to have a good relationship with all your healthcare professionals and especially with your eye doctor. Um, and so I want to really thank you, Dr. Hunter, for just taking some time out. And I hope that people find this podcast very educational. I think I found it, very educational. What would you say to sum up kind of like what the main thing that you want to get across to people in dealing with type 2 diabetes and eye health?
First thing I would say is make sure that if you have diabetes, and even before you have diabetes, just get regular eye exams, just because sometimes you can sometimes diagnose diabetes before the primary care. If you're not seeing a primary care doctor, but you're seeing your eye doctor, sometimes we see the early signs of diabetic retinopathy before the diagnosis. It's not uncommon for me to say, "When's the last time you seen your doctor?" And they'll say, "Oh, about 5 or 10 years ago." And I'm like, "You need to get in with your doc. I think you may have diabetes." And so really, you know, catching in order to, again, it's not even for diabetes. You get in a regular eye exam, you're catching things like glaucoma, which is absolutely needs to be treated early in the disease. And so you catch that stuff early. So if you're, you know, uh, above 40, I would say regular eye exams should be a part of your overall health. Um, and then, if you, and then, I tell all my patients as well, I'm like, look, even the ones who don't have diabetes, you know, you need to control what's going into your body. There are certain foods you should not be eating. We've all been, you know, told that food, even as we were kids, that food is our friend. Food is not our friend, not the food that's processed here in the United States. And so you really have to control what's going into your body, and controlling your weight, trying to prevent obesity. I hate seeing, a lot of my patients being obese, a lot of their children being obese. I tell them, I was like, look, even if you feel like you've given up on what you're gonna eat, I say, don't teach your kids the same habits that we, and I included myself in that, we were taught as kids. They gave us this pyramid and they said eat all these different foods, and they made being obese look like it was cute and sexy and so forth. And we didn't realize that we were all killing ourselves with the junk foods and the fast foods and all the things that we eat. I said, at the minimum thing you can do is teach your children and your grandchildren that even though you may have that weight problem, that it's not okay, and you have to teach them better habits, right? I teach my kids better habits than I was taught, right? I teach them that alcohol is bad and smoking's bad and all these things that we know is destroying our health, right? So, you know, teach them that, right? Learn to eat the right foods and lose the weight, right? And we'll be healthier in our bodies, in our minds, in our eyes. Um, because again, once the problems start, sometimes they're hard to manage. All right. So let's catch it before it becomes a problem.
Amen. Amen to that. Yep, that's definitely it. Yep. Yeah, we talk about that a lot here about the standard American diet and all the problems with that. And so just yeah, just as I said, again, thank you, Dr. Hunter, and passing some pearls of wisdom to our audience. And I invite anybody in our audience, if you have any questions, we have email in the show notes that you can contact me, and I can pass it along to Dr. Hunter. And Dr. Hunter again is at the Duke Eye Center in Durham, North Carolina. And so if you live in Durham area or whatever, it might be, I don't know if he's taking new patients or not, but they have a great staff over there, great staff. And I've been going there for years, and my family's been going there for a long time, so I can definitely recommend that. And so again, like I said, thank you again, Dr. Hunter. Um, and like I said, we appreciate all the support that we receive from everyone. And feel free to, like I said, give us feedback about the podcast. And like if you have any questions about type 2 diabetes and eye health or anything else about type 2 diabetes, just contact us and we'll contact you back, and we'll see if we can answer your questions. And so thank everyone for listening. Just continue to support the podcast. And I just hope that you continue to be well.
Thank you for joining us on this informative journey. The content of this podcast is solely the professional opinion of the host for informational purposes only. It should not be considered a substitute for professional medical advice, diagnosis, or treatment. If you're experiencing any health issues or concerns, we strongly recommend that you seek the counsel of a qualified healthcare provider before making any changes.